Good morning, ladies and gentlemen. We will call the County Council meeting of June 21st, 2023 to order. Nope, you still don't have it, Jeanette. There.
Moved by Councillor Greenwood Spears, seconded by Deputy Warden Smith. Resolved that council resolve itself into committee of the whole closed session as authorized under section 239 of the Municipal Act to consider adoption of closed minutes of meeting held April 19th, 2023. There's also an additional set of minutes of the special meeting held April 26th, 2023. And then a position, plan, procedure, criteria, or instruction to be applied to any negotiations carried on or to be carried on by or on behalf of the municipality or local board as it relates to the Township of North Frontenac Seniors Housing Criteria, and a proposed or pending acquisition or disposition of land by the municipality or local board as it relates to property acquisitions for the KMP Trail.
You've heard that. Any questions or comments? All in favor? Carry. Okay, welcome back, ladies and gentlemen, to the council meeting. We will call the meeting back to order, and we have a resolution for rising out of committee of the in camera.
Moved by Counselor Saunders, seconded by Counselor Gaudy, resolved that council rise from committee of the whole closed session without reporting.
All in favor? Carried. At this time, though, we did call the meeting to order earlier. Jeanette didn't do a roll call or any of that. It says on here that she was gonna, so I will have that now.
Your worship, we do have quorum.
Oh, okay, so that's good enough. Any disclosure of pecuniary interest or general nature thereof? Must be none recorded. Adoption of the minutes.
Moved by Counselor Leonard, seconded by Counselor Fowler, resolved that the minutes of the regular council meeting held May 17th, 2023 be adopted.
Any questions or comments? All in favor? Carry. Then at this time, we have delegations and presentations. So it's my privilege today to call on Kimberly. Move into committee of the whole.
Moved by Counselor Lichty, seconded by Counselor Greenwood Spears, that council adjourn and meet as committee of the whole council with the deputy warden in the chair.
All in favor? Carry. Nice.
Just pass it in the night.
Okay. Our first item of business is report from our CAO, Mr. Kelly Pender.
So while Brianna's doing that, this is your CAO report for June the 21st, and recognizing we do have a busy agenda, I'll just do a couple of highlights on each slide, but as always, if there are any follow-up or questions through you, Deputy Warden, be pleased to answer them or follow up afterwards. The past month has been extremely busy with meetings, both county related and Warden's Caucus related. And we'll get into the Warden's Caucus in a moment. In particular, and we're moving on to slide 3. On Friday, we will be reviewing the business case for the 7 and 7 housing project that we'll be presenting. The Warden's Caucus will be presenting to Minister Clark at AMO in August. It's about 80 pages long, so this is the business case, not the business plan. The business plan will follow, assuming that the ministry is in agreement. It highlights some of the ways that this project could be undertaken and confirms that there is definitely the need for the 7,000 homes. And we'll be working through that process at the Warden's Caucus meeting in July that the Warden will be attending in Northumberland. There are several AMO communications that may be of interest to your local townships, and I won't go through those in any great detail, and move right on to the administrative building update. So on Tuesday, we had our bi-weekly meeting with the administrative with the contractor and with the architect and our team. We also did a walkthrough the week before with our staff committee that is looking at fit and finishes and desks and those things. And Brianna has been leading that process along with Sonia Bolton and Melissa Pedler and several others. So we'll be looking at the details of those things as we move along. The addition, as we advised council a few weeks back, they did find bedrock for the east addition, which is good. It was between 0.5 meter and 1 meter deeper. So there were there is some extras with respect to gravel, and they had to do some underpinning on the existing building. Back in the day, they just dug a hole, threw a bunch of rocks in it and threw a bunch of concrete on it, which is it's still standing. It has not fallen into a hole, but does not meet today's standards. But we're moving forward with that. Over the next month or so, we'll be working with the architect and bringing back a recommendation with respect to the 3rd floor. The engineering and the change order have been complete as council directed in April. But we will be looking at how that will be happening and making a recommendation to council. All of the framing, drywall, and electrical and ceiling is in place in the former paramedic suite, which is the Conservation Authority area. Most of the framing and drywall is in place in the old house, so it looks much different than it did when you last saw it a year ago, if you were in the building, or even since the Warden was in about 6 weeks ago. It looks completely different. So we're making good progress. The slide on the screen will give you a sense of where the east addition is going. So you can see the excavation, which is essentially, thank you, Brianna, the excavation area and the area that has been dug out towards the septic field to the south has been completed. And since that has taken place, the excavation and the gravel has been put in place, and they were anticipating forming on Tuesday. I didn't drive by today to check that they were, but so we're making good progress on that, and looking forward to move-in time. So here we are. This is the back of the building looking towards the excavation. On the right is where the paramedic suite will be. So it will be at ground level, but below the level of the first floor, if that makes any sense. So there'll be a walkout there. And looking back on the left is towards the Conservation Authority space. And that's where the south addition was to be, but it has now been filled, compacted, and topsoiled. In terms of human resources, so we're not quite halfway through the year, but we're already at 213 postings, which has kept our HR staff quite busy. Some new innovations in that front. Of course, through the pandemic, we're doing a lot more virtually than we ever were, which is a time saver as well as has shown itself to be an efficient way of doing things for a lot of our positions. We've had 6 new hires for Fairmount in the last month, and our occupational health nurse recruitment process is complete. And it says an offer is out, but I understand the offer has been accepted. Brianne Marshall, who is a registered nurse at Fairmount and also is certified in occupational health and safety through Queen's University, has accepted the position. Bonnie Carter, our current occupational health nurse, will be retiring in August. So we're making progress there. Brianne is a assistant director of care at Fairmount, so that recruitment will follow. We do have a number of acting superintendents and temporary full-time recruitment that has been ongoing and largely complete. QP 109 agreement, as you know, is finalized. The OPSU agreement is in process, approved, but still going through the back and forth in terms of getting the final copies for signature. And we've moved on to QP 2290 pay equity adjustments being finalized and ready for payout. The memorandum of understanding with the union is that we review pay equity, and that is now complete. And we have 3 ongoing investigations and reporting complete in the month of June. Excited about our HRS project, which is the actual product is called Star Garden, which, as council is aware, we co-tendered with the United Counties of Leeds and Grenville, and the bulk of the funding came through municipal modernization. So training has been ongoing. In fact, I was in half hours worth of training last week, which is about all they'll let me touch, to look at how the various programs work and come together. Candace Keller is leading that project, our HR generalist extraordinaire. And we thank Candace and the payroll staff and all the frontline staff for their patience as we move through that system. Like everything else, there are glitches, but for the most part, they're just a matter of walking individuals through it and making it happen. We've also implemented the performance management, succession management, are in testing phase, but we looked at the product last week and making progress on that. Next slide, please. Frontline, so we celebrated Paramedic Week on May the 21st to 27th, and had a, there we go, thank you. Had an event for paramedics. Also the walk for ALS. Dale Hodgins, one of our longtime paramedics and a truly wonderful individual, passed away on June the 9th, 2020 from ALS, and paramedics wear purple epaulets in honor of Dale and participate in an ALS walk to raise funds. Our esteemed Deputy Chief Mark Gowdy completed his Certified Health Executive certification. To achieve this designation, college members must demonstrate competencies in several key areas that have been determined to be essential in fulfilling professional responsibilities as health leaders. The completion of the CHE program requires the candidates to demonstrate significant commitment to the profession as well as ongoing professional development. And I don't know how Mark does it. He has 4 young kids under about the age of 10. He has working on his second master's degree and a number of different things ongoing, but Mark is truly an inspiration. Next slide. Proud to have volunteers Bill McCormick and Marlene Bayette on our care team, offering congratulations on their milestone achievement in 2023 for volunteering for 5 years. And Bill and his pups from Sheba Haven Bill would always come into the office and introduce us to his pups, and he had it was always fun to have Bill in the office, and I know that our residents at Fairmount really appreciate Bill's efforts and enjoy seeing the pups every week or so. So on behalf of staff and council, a big thank you to both Bill and Marlene for their contributions to Fairmount. So the Walk for Alzheimer's, and this is a particularly important charity for our staff at Fairmount. They raised about $3,100 for our local Alzheimer's Society. Last week in Niagara Falls, Kevin, Brianna, and Jeanette were present to receive an EA Danby Certificate of Merit in Excellent Municipal Administration for the implementation of the LIFT program. So it's been ongoing since 2017, and it's been ingrained in part of, just every part of what we do and how we work through that. Kevin is now leading a new group of yellow belts through their first projects, and we hope to be presenting yellow belts to staff or to the staff at a council meeting to sometime before Christmas.
And LIFT stands for?
Lean Implementation Frontenac Team. Next slide, please. So we had about 61,543, not approximately, I guess that's exact, online engagements in May, a strong surge across channels from April. And Matt reports that the surge is typical for April, May, and previous years. The top most visited landing site continues to be related to ferry travel, Howe Island, Careers, Frontenac, and the KMP Trail in that order. Next slide, please. And just a couple of highlights. Our top performing post in May related to the paramedic Stork and Save pins. 30 paramedics on May the 30th. Paramedic Michael Pash's last call on May the 17th, and again, a long time paramedic and retiree, and we appreciate Michael's service. Upcoming and ongoing Fairmount Home staff recruitment and brand ID, new advertising campaign and plans are underway, and also communications and KP and analytics projects as part of our accreditation and ongoing reporting to the province. Planning update, the zoning housekeeping amendments for the North Frontenac and Central Frontenac zoning bylaws are underway. And that's fairly typical after the passage of a zoning bylaw, that there are a number of small housekeeping items. So thank you to the staff at North Frontenac and Central Frontenac as we work through those, and appreciate their service in identifying those as we go forward, typically through a building inspector or the frontline staff as they receive applications. They notice minor things, and we tend to do a fairly significant cleanup of those and get them all underway. The pre-application and consultation bylaws, planning staff have assisted the township in the development of the new pre-application consultation bylaws, and the bylaws require applicants to consult with staff prior to submitting a planning application. And this is largely being driven by Bill 109, which requires the refunding of applications. So we want to be very clear in terms of what the process is so that we aren't refunding fees prematurely. And I understand South is going through a similar process as well and working with the staffs.
So that would be the same process. Then they have to sit down and they have to make sure everything is correct before they can actually submit, right?
Correct.
Yeah.
Perfect. So it's actually very helpful for the applicant as well, because they know all the requirements up front. It's not one of those you get to the end and, oh, by the way, left-handers can't score goals on Tuesday. You have to go back to the beginning. So it puts the onus on staff and the applicant to make sure that everything is in place. County planning staff and working with the CAOs with respect to preparing an RFP to obtain services for a consultant to undertake the natural heritage review And again, this service is a temporary measure to address the fact that Bill 23 prevents the conservation authorities from providing the service. So what CAOs agreed to a few weeks back was, let's try the RFP process, see what happens. Can we get qualified applicants, and what are the costs? Because those costs will inevitably get passed along to the applicant. And next slide, please. Applications for May and June continue to be high for both North and Central, and staff continue to receive a steady volume of development inquiries. So still making lots of applications, and staff continue to be processing them along with the frontline staff in the townships. Next slide, please. Economic development update. There was a what we euphemistically call a FAM tour of Wolf Island, and it was done in the smoke, but it was very helpful to get tourism staff from Kingston involved in what are things that can be offered on Wolf Island, and we appreciate everybody that was involved in that, and some very favorable responses back. Oops, sorry, one back. Over 15 small businesses also joined the county staff in a workshop and developing tourism experiences in Frontenac County, and presentations were provided by MT Adventures, Maple Ridge Farm, and the KMP Trail. So next slide, please.
I'm not looking for any more meetings or anything like that to go to, but I was wondering on that, council actually never hears what businesses are thinking. Or because they have these workshops, and I'm sure there's a lot of great ideas. I know Richard goes, obviously, but we never get to hear what they see as the challenge or what they see as the opportunity. And it would be kind of nice if we could get at least some sort of a mini update just to say, well, this is the discussions and this is what they found.
We
Very
do
difficult.
we do an annual survey that's reported to council. Where are we in that cycle, Richard?
So we reported to the Planning and Economic Development Committee survey results last meeting.
Okay.
And we'll be providing an update on all of the sort of small business initiatives that we've done over the past 6 months. Then have the next Planning and Economic Development Committee that's going to be busy. But the one after that. Oh no, actually it's going to be on the agenda. Listen to that.
Well, it's nice to see the wins, but it's also nice to see the challenges.
Yeah.
Yeah.
I mean, when they answer a survey most time or whatever, the report comes, this is great, this is great, this is great. But it's also nice to see, no, it's not nice to see, but it's good to see what they find is very difficult or challenging.
We'll include the challenges in our report. Perfect. Thank you.
And just a reminder of the July 5th meeting that it will be held at the Verona Lions Hall to review the survey results and to hear public comments with regards to ATVs. One last minute update. Yesterday morning at 9 o'clock, Mayor Lichty from North Frontenac hosted a special meeting to talk about the Municipal Service Corporation and the potential for participating in that. I'll leave the good news to the mayor, but sitting here is with his mayor's hat on as opposed to his councilor's hat, but it was a very informative meeting and good participation all around the council table and from those present. But with your indulgence, Deputy Mayor.
So after a lot of discussion, and it was a long meeting, we broke with protocol a couple of times to make sure everybody had a final say, but council adopted the right to join or decided to join the Municipal Service Corporation and the Communal Water System Initiative. So we're now on board as well with the other three. Looking forward to participating, see where it all goes. We're all together.
So just in terms of the process at this point, I'll be speaking to our lawyer who has participated in this project from the beginning, Harold Van Winson from Templeman, to initiate the process. The first part is fairly simple in terms of they have to do a formal name search and then there would be letters of patent and incorporation, which go back to the federal government, provincial government, be incorporated provincially, and that'll take several months. In the meantime, the CAOs and the treasurers have committed to reviewing the budget and working through the next steps. At each of your councils, you're going to need to appoint a representative to the Municipal Service Corporation, which will probably be like a September kind of thing. The original thinking of the committee was that that would be the 4 mayors, but that is, to be determined at each council who that would be. And hopefully we can have our first annual general meeting at some point early in 2024 and begin the process. One of the other steps is what's called the development of bylaw number 1, which we went through that same process for the Eastern Ontario Leadership Council 2 years ago, I believe. So it's a fairly patterned bylaw. It just states that this is how the organization is to be constituted, and that gets approved by the board of directors at their first meeting. Now they can adjust it afterwards, but that bylaw needs to be in place at your annual general meeting. So look forward to developing a work plan and refining the budget and working through that. A number of the costs that were in the original budget have already been, not a number, 2 in particular. They originally budgeted for the development of the business case, but Joe and I completed that in-house. There was also some legal fees included in that, but the committee authorized those legal fees as part of the committee. So although we've had some inflation, we've also had some adjustments on the expense side. So I think we're probably still quite good in terms of the budget. In fact, in my discussion with the CAOs and the treasurers is that is the budget. We will make it work and bring back a work plan for the review of the board of directors. So
I just had a comment, one back. I wanted to give credit to the county, and I assume Richard. The trail thing is very well advertised. When they put a sign up, they put them up. I think we're cheaper than that. We always try to use a reusable one, but I think if anybody says they didn't know about it, then I don't know what they were doing. I just want to comment though that it's very well publicized and we're giving everybody an opportunity. So I think that's great.
thank you.
At this point, I just want to go back to a proclamation. Today is Indigenous Day, and I believe our clerk is going to read a proclamation.
So we first have a resolution just to amend the agenda that's moved by Warden Vandewaal, seconded by Deputy Warden Smith, that procedural bylaw 2022-0026 be waived to add a proclamation regarding National Indigenous Day.
Discussion? All those in favor? Carried.
And that's moved by Warden Vandewaal, seconded by Deputy Warden Smith, whereas the Constitution of Canada recognizes the existing rights of the Indigenous people of Canada, and whereas in the Constitution of Canada includes Indigenous peoples, and whereas the Indigenous peoples of Canada have made and continue to make valuable contributions to Canadian society, and it is considered appropriate that there be in each year a day to mark and celebrate these contributions and to recognize the different cultures of the Indigenous peoples of Canada. And whereas many Indigenous peoples celebrate the summer solstice, which has an important symbolism within their culture, therefore be it resolved that the Council of the County of Frontenac hereby proclaims June 21st, 2023 as National Indigenous Day in Frontenac County.
Just going back to AMO and that they had a free assessment for disability management programs in June. Did we take advantage of that?
Madam Clerk, did we take advantage of it?
Sorry, what was, I missed the question?
AMO had a free assessment of disability management programs available during June. And I wondered if we took advantage of that. It was offered, and since we have long-term disability issues and that, I just thought we probably benefit from having an assessment done. I didn't know if we had it done.
I don't believe so, but I think I would defer that to our Director of HR who looks after disability, but I don't believe we have done anything with that.
No, we did not participate in that.
Okay. And I have a second question.
Still available? Do you know? You
Just-
said for June, so.
It's in his report that's available until June 2024. So whether it ended at the beginning of June or whether it's to the end, I don't know. It caught my attention considering the amount of claims that we have. It'd be a good thing. And another HR question that I had, and that's regarding the HRIS. And I believe it's already settled law on that, that as an employer and that we need to be proactive in making sure that employees get their pay stub sent automatically to them. Is that the case? Because I know as counselors, we don't usually get an automatic stub. I don't. No, yeah, that's what my point though, in that I believe it's already settled that it has to be proactive on the employer part to send that piece out. And that's, it's like getting your T4 slips, it has to be proactive. Thank you.
Hey, Bill, go ahead.
This must be Frontenac Islands Township Day. With your indulgence, I have three questions for the CEO. I'll give them all three at the same time. There is work underway, you understand, regarding a replacement for the marine building for Howe Island Ferry. We would request that county staff provide an update to Township Council regarding the status of that. And in particular, since the current agreement with MTO, we'd assume that we would be responsible for like 20% of the cost. So that would be a budgeting issue. So we'd request an update. Second question is, as always, do we have an update on staffing for the Howe Island Ferry? And the third question asked is, we continue to hear concerns about late payment of invoices. And I'm wondering, based on the phenomenal work that Kevin and his team have done, he's ignoring me, whether it would be possible to have them direct some of the resources to determine if there's an inherent issue with the invoice payment system. Thank you.
Through you, Deputy Warden. First things first. So at this point, all that MTO is doing is surveying the property at their cost. There is no cost to the township for that service. At that point, they'll determine whether a new building can be built because there are a number of property issues there. So it is where the city of Kingston road allowance meets MTO property, which meets Crown land. So there are a number of issues. So until a survey is complete, and I was speaking with Mr. Dillabaugh as I was driving in this morning, stuck in traffic. Thank you, Madam Clerk. No, we were both stuck in traffic. That he is also requesting that they survey the South Shore as well, so that we have a clear idea of where the property lines are. I expect that whole process is going to take a year or two before they figure out whether it's even possible, at which point they'll be back to the township with any cost sharing issues. They won't commit at this point to any construction timelines till they figure out what's up. Having said that, and it was back during the pandemic, that there was mold issues in the building, which have been rectified. Well, our good friend Kevin was leading the ferry service. But it is a building on stilts. At some point, that mold is going to come back, and MTO is aware of that issue. So I will be meeting with your new CAO at some point next week, and he will be involved in those discussions and will be relaying that information to your council. But as we know around this table, none of those costs are county costs, they're all the township. So they're going to have to negotiate with the township, not with the county. So you will be quite well informed on those issues. With respect to the invoicing, there has been a number of issues with coding of the invoices, which is a township issue. So when the invoices are coded, they come to the county, but there have been a few that have been missed. And I spoke to the treasurer earlier this week, and we will be reviewing that with your CAO and with our payroll or our accounts payable staff. And I'll turn it over to Barb if you know the numbers with respect to recruitment.
I believe we still have 2 part-time ferry operator positions that we're recruiting for. We had put an offer out for one and then rescinded it for specific reasons. So we're still have a couple of openings, and I think they're looking to see when the next program is going to be run as well.
Okay, any other questions for the CAO? Okay, you have to leave, okay? The warden has to leave, so I'm in charge. Totally in charge. Okay, Chief Gail Chevalier is going to join the CAO to talk about the paramedic study refresh 2023 that was in our packages.
So I'm just going to introduce the Warden's Caucus portion of this. I was the Warden's Caucus CAO lead for this project, so just review a bit of the process and how we got to here. And then I'll turn it over to the person who really knows things. So back last fall, we hired Apex Pro, who did the 2019 report. And as this council knows, because we approved it, Frontenac County was the host for that. So it's about less than $5,000 per service to get the detailed information that you see today. The full report did include a detailed summary of each of the services, but we're only presenting the Frontenac portion and the roll-up portion. Next slide, please. So this is a very data-rich report, and Apex Pro, they do this all across Canada, so they know their stuff. They've worked with the Warden's Caucus and with paramedic chiefs for a number of years on various reports. But we're going to do it at a fairly high level. But certainly as we're working through it, questions are welcome. And for today's purposes, we're primarily going to concentrate on the bigger picture. But there are a few highlights on the Frontenac paramedic side, and the full report is included in the agenda package. So originally 2019, Apex Pro was hired to do the first report. And if you're interested, that full report is on the Engage Frontenac site with the link there. But I think the discussion at the Warden's Caucus was things have changed. Everything through the pandemic, wait times increased, the amount of time on task increased, and we need to have a picture of this for meeting with the Minister of Health and discussing how paramedics are going to look. So this is the full report. Next slide, please. So just to give you a heads up in terms of what is covered and what isn't covered. In particular, what isn't covered is the city of Ottawa. They are not part of the Eastern Ontario Warden's Caucus, but essentially we're from Haliburton and Kawartha Lakes in Northumberland in the west, up to Renfrew County in the north, and Prescott Russell and Stormont, Dundas, and Glengarry in the east. The 3 largest services are Frontenac, Peterborough, Hastings, and Prince Edward. So in all of those categories, those are the ones that we generally compare ourselves to as we go through the process, but all are there for your information. Frontenac County is managed by the Central Ambulance Dispatch Communications, CAC, out of Kingston. So from a operational standpoint, Chief Chevalier has input into the process, but the final say is provincial in terms of how CAC operates. But it dispatches from Lanark County, Lees and Grenville in the east, to Hastings County in the west. So all of that territory and I'll ask Joe to confirm that, Brown in the middle, we tease Joe about his colorblind, is dispatched out of Kingston and managed by the province of Ontario. And our referral center is largely to Kingston General Hospital here in Kingston, although there are a number of instances where from North Frontenac, for example, they may go to Perth and Smith Falls or directly into Ottawa. But again, that is managed through the CAC, not through the individual service. Frontenac is supported by tiered response agreements with your municipalities. So each of your municipalities has an agreement, and the city of Kingston has an agreement with the county with respect to how your firefighters respond. And that is in each township's control, not the county's control, not the provincial's control. There are some mandatory things that you have to respond to, but your tiered response agreement is your tiered response agreement. Next slide, please. Oh, you've got it. So what is the purpose of the refresh? New and updated environmental scan, things like community paramedicine are new to the process. Develop a new updated 5-year predictive forecast, including sensitivity analysis that we'll go through, and identify paramedic priority areas that the EOWC should focus on. So the Warden's Caucus doesn't deal with individual County of Frontenac issues or County of Hastings issues. We deal with region-wide issues. So what are those areas that we should focus on? Having said that, I think every one of the 4 priority areas is something that's important to Frontenac as well. Next slide, please. So the EOWC report is one part of our work. In 2019, we also did a 10-year paramedic human resources and facility master plan. So that is the really deep dive. So the Warden's Caucus, the one that we're presenting to you today, will give you a good sense of where we sit in Eastern Ontario, what are the trends across the province or across Eastern Ontario, but doesn't give you a deep dive into, you know, how many calls are being answered out of Parham. That is what the 10-year paramedic and human resources plan is. So that was 2019. This fall, you'll be seeing a project proposal to do a refresh of that in 2024, because there's been a number of changes. In particular, the building of the Battersea base, which we now have a building permit for, and the city has rearranged their fire halls that we're going to be partnering on. So we'll be asking council to do a refresh of that in 2024.
Ron has a question.
We're just not going to use statistics over the last 4 years, all right? Because we know it's going to change again.
Correct.
We assume now that COVID's over, I'm not saying it's going to go back to what it was, but no different than our building departments and everything else. We just couldn't gear for those 3 or 4 years, right?
Yeah, and what Mr. Rubenstein has done, what Apex Pro has done is looked at, you know, what is the best case scenario, what's the worst case scenario, and what is the likely scenario, so that we can do a range. And in our 2019 detail dive, we also did the same thing. Now, coincidentally, in 2019, when we did both reports the last time, the numbers were fairly close. They were plus or minus 1%. So it'll be interesting when we do the next report in 2024 to compare that to what Apex Pro has done. But that'll be a deeper dive into what is happening in Frontenac and Kingston.
Okay, and I appreciate the regression line that we were going to be looking at. But what I was wondering, with this poor air quality that we've had very recently, was there an uptick in respiratory calls? And that, because this, if so, this could be part of our new reality too, whether there's COVID or not.
Right, we didn't see a huge uptick, but it only lasted, you know, a couple of days. So I think if it had been sustained for longer, we probably would have seen a bigger spike in calls for respiratory problems during that time.
Okay, and based on last year or in the past few years, when we get into the high temperatures with humidity, has there been an uptick?
Yes.
Thank you.
So with that, I'll turn it over to Chief Chevalier to go through the findings, and I'll become the AV assistant.
Awesome. So the Eastern Ontario Wardens Caucus, the report made a number of findings for Eastern Ontario, but they all are applicable to Frontenac. So the first finding was that call volumes are increasing where paramedic service performance is declining. So it's between 2018 and 2022, it's important to note that our time on task increased, which is worse by 46%, and our unit utilization, or our UHU, which we report to council regularly, worsened by 32%. The second report finding was that declining paramedic service performance is attributed mainly to a rapid increase in hospital offload delay. So this is, as I've reported to council before, where we saw the biggest change. Our calls are taking a little bit longer, but our offload delay has increased significantly. So between 2018 and 2022, it increased by 161%. And the number of hours increased by 383%. And it's estimated that's costing about $17 million a year to the Eastern Ontario Paramedic Services to compensate for that. Brent?
These hospital offload delays, what's the big disconnect there? Is it, I guess you're waiting for the hospital to take over the patient?
That's correct. So offload delays are primarily a hospital flow problem, and exacerbated through COVID with their staffing issues and the increased number of patients. When they have all of their beds in the hospital filled, they can't move patients from emerge into the hospital that need to be admitted. And at the same time, paramedic services are bringing more patients to the emergency department, and it's just backing up, and they don't have the capacity to move the patients through. So the paramedics are waiting in the hospital waiting area before their patients can be offloaded and they can get back out into the community.
Is the province are they going to be trying to help out with that problem? Because that's a major problem. I mean, look at the high percentages. It's really striking.
So the province is certainly aware of the problem, and the Ontario Association of Paramedic Chiefs have been advocating actively with the province. Individual hospitals and services are putting in place, sort of Band-Aid solutions to try to mitigate it in the short term. It's a problem that impacts paramedic services significantly, but it's actually a hospital problem. So there is a program that we're participating in called the Offload Nurse Funding. So we receive funding every year to have a extra nurse in the emergency department who can take non-acute patients in a section and get them off of the paramedic stretchers. So we have for the upcoming year applied for extra funding for that in hopes that we can maybe have more of those patients offloaded from our stretchers and not be waiting in emerge.
Okay, Judy?
On that point of the offload nursing, are you hiring directly that nurse so that they're accountable to the paramedics? Or are you counting on the hospital who is already working under short nursing staffing and may hijack that nurse?
So the funding is flowed through us directly to the hospital. So it is a hospital nurse that fills that position.
So you're tracking the number of hours that they are actually in the emergency department, and it should be working better.
Correct.
Okay, and second to that, has anybody made a presentation to the board at the hospital to point out just how significant of an impact this is having on the paramedic services? Because the board can then look at that from a governance perspective and put a little pressure perhaps on this CAO or their version that to make sure that it improves. Because if not, from a hospital perspective, and that they look, well, that patient is being covered off by somebody stable and they are not put at the highest priority, but with that level of funding impact and that they should be moved up if we're actually working together in a healthcare team.
So we haven't done a presentation to the board. We work directly with one of their directors and certainly have a contact when we get a number of crews in emerge that we can call, and they work to try to move that along as quickly as they can. But no, we haven't done a presentation to the board.
Okay, I would suggest that maybe that would be helpful to make sure the board's well informed. And are the ambulances ever directed to take the less urgent patient to Hotel Dieu?
No, that's a opportunity that we have investigated. Under our response plans, we can only take a patient to Kingston General. And in order to have an agreement where we could take them to Hotel Dieu, they would have to agree to that, and they have not so far.
They have not, as in the hospital, or?
Right.
Okay, because that can be brought forward to the board as well in that, because it seems we've got two hospitals, and I'm pretty sure that you could appreciate that some don't require the level of surgery intervention or something that you would expect at KGH that might be able to be better assessed and that at the hotel do.
Yes, we certainly recognize that. And, you know, the public is given guidance as to whether their problem is more appropriate for a Kingston General or a Hotel Do. And I think certainly the paramedics are in a really good position to recognize which patients would more appropriately be transported to each of those.
It's just a comment. I know it says here declining paramedic service and the increase is hospital offload delay. I would appreciate if you put the H in it too, to actually the acronym could be hold instead of old. I mean,
I
if
saw
you
that
didn't
as well.
explain it and you just saw the acronym old, at least hold is because we know the holdup is there. It's not just us people.
Good point.
The only thing I'd add to this slide is that $17 million a year, roughly 50% of that is municipal local taxpayer dollars. That's not all Frontenac, that's across the whole jurisdiction, but you know, we pay 50% of the tab.
Municipalities pay without any money coming back for our first responders, which needs to change down the road.
So the third finding of the report is that based on all of this, many services are reporting that paramedic workloads are not sustainable. So paramedics are spending more time on task, being stuck in offload delay. This is causing unscheduled overtime. If the crew's stuck at the hospital at the end of their shift, they're not able to get off, often when they haven't had a break throughout the day. So what services are finding is this is impacting paramedics and morale. Absenteeism's on the rise. And there's a lot more paramedics off for mental wellness reasons, and paramedics leaving the services entirely and moving on to something outside of healthcare. Next slide. And of course, this has other impacts on dollars, paying the increased overtime, WSIB claims, and the cost of getting paramedics back to work and ongoing recruitment to replace those paramedics. Next slide, please. So the fourth finding is that several services are reporting inordinate amounts of time out of area, affecting their local area coverage and costs. So when a service does a out of area transfer to one of the tertiary care hospitals like Kingston General or Ottawa, which isn't part of this report, they're having the offload delays there. So a out of town ambulance is stuck in a different community for a prolonged period of time and not able to get back to their own community. So that's impacting their ability to respond. And for Kingston, you know, we're lucky in the fact that we have the tertiary care center, but because more patients are being brought in from outside of our area and are being stuck in offload, that's impacting how long our offload delays are as well, because we're waiting for the patients ahead of us to get cleared. So it's causing a large amount of contribution to the offload delay and costing a lot of money. Judy?
It's actually back to the previous point when you were talking about the turnover and absenteeism. And I just wondered if our county HR was doing exit interviews for all the people that are leaving, and that so we get a better picture. How many are leaving for a full-time role somewhere else? How many are leaving altogether, or how many are leaving just dissatisfied? And that it would be nice to have a good picture in that, and having an independent or relatively independent exit interview might be very helpful.
Barb, do you want to speak to that?
Sure. Yes, we send out exit interviews. It's an online survey to any exiting employee. Unfortunately, we don't get a lot of uptake on completion. But we do send them out and we do take a look at that. If we see concerns and they've signed off that it can be shared with the department director, then we send that on to the department director as well.
Just a point in my past life, and that when somebody was putting their notice in, I always did an outreach to them directly, and that just to also find out if it's a hard case that they're leaving or if there's something that can be done to retain them. And especially when you have such a staff shortage, and that being, again, a little more proactive and caring, that might help to have somebody that thought it was an insurmountable problem, whether it was childcare or something else, something might be able to be managed differently in that. So just being a little bit more proactive and direct in a human case rather than just doing an online survey be my suggestion.
We need to keep our questions a little shorter, or we're never going to get through all of the agenda today. So Gail, you go ahead.
Okay, so the community paramedicine programs are proving beneficial in reducing 911 calls. So across the region, it's believed that if community paramedicine didn't exist, the call volume would be 4 to 5% higher. So the priority recommendations, and this is where we need councils to help advocate for us. That first one is that hospital offload delay needs to be fixed. So as I explained, this is a flow problem with the hospitals, but it's creating a situation where paramedics are not available to respond to calls in their community. So if there's more emergency patients backing up and decreased nurses, this problem needs to be fixed. Community paramedicine programs require provincial commitment to permanent and predictable funding. So currently, our community paramedicine money comes in a number of separate buckets, all for different programs, often which sort of overlap, all of that have reporting requirements that are different, and their guarantee is not the same. So our HISH program, we find out annually if it's being extended and by how much. They funded the CPLTC program for 4 years, and now they've just announced that they're adding on a couple of additional years. So what we need is to have the funding guaranteed so that we can hire proactively going forward. And it needs to be paid 100% by the province. It's not going to work if it becomes part of our 50-50 funding, because then the municipalities are going to be required to spend 50% of the money. So that's a huge thing that we need. Dispatch needs to be modernized to ensure the deployment of appropriate resources. So right now, it's about 70% of our calls are dispatched at the highest priority, but when the paramedics arrive on scene, only about 26% of those calls are actually of that acute priority. There's a new dispatch system that is slowly being rolled out by the province, and it's due to arrive in the Kingston CAC area either at the end of 2024 or the beginning of 25, which should help because it will allow us to prioritize how quickly we respond to some of the less acute patients, which will free the ambulances up to be able to get to the more acute patients. But there's other components to this system that are being utilized across the world, particularly over in Europe, where they have a different person in the actual 911 dispatch center, be it a nurse or a physician or a community paramedic, who's able to divert those calls right at the time that they come into the call center, and they're not actually sending an ambulance and then sending them out from there. So things like that need to be upgraded moving forward.
Quick question, when we have patients that are relatively stable and that need to be transported, are we ever using private ambulance service? In other words, when they're going out of the area for up to Toronto and that, because they're being transferred up for MRI or some other specialty piece that we aren't able to do here, are we always using one of our ambulances, or there are private transports that can be used?
The majority of calls like that are done by private transport. We only respond to 911 calls. We don't generally do routine transfers unless there's a specific reason that they need a paramedic on board.
Okay, and one more question, that because we only have anecdotal evidence on the impact of the community paramedic programs, that what steps can we take to get it beyond anecdotal?
Well, that's a province-wide question. It's really hard to measure something that you're preventing, right? So it's hard to measure the cost of paramedic calls when you've averted them by having the community paramedics. The other, important thing is that the savings is to the entire healthcare system. There's not as much direct savings directly to the paramedic service. It's about having less patients in emerge, less patients admitted, and keeping patients at home. And that's where a lot of the costs come in. That's a provincial.
And I can say from experience, I have neighbors that the community paramedics go to visit, and it keeps her in her home. Otherwise, she would be trying to get into a long-term care.
Right.
Okay, and the final question, have we looked at hiring directly RNs that work at the hospital, get an agreement with them and say, these are paramedic RNs, basically to do that transfer? if we can't reliably count on the hospital who's getting funding for providing an RN to do the offload?
I'm not sure I understand the question.
Well, instead of just hiring paramedics, could you hire 2 RNs to cover off the 12-hour shift and that for 6 days a week, which is your high point of when you're having the holds at the hospital, and they be your staff basically to take the handoff of the ambulance coming in and help speed that up?
So we have been talking to KGH about if there's opportunities to do that and whose employee it would be. The funding, has recently opened up to allow more than just the hospital nurse. So it's one of the avenues that's being investigated. So the report made a number of observations. All of these do apply to the County of Frontenac, and our experience is similar to the rest of Eastern Ontario. So we're all being compliant with legislation, providing primary and advanced care paramedics. It's a seamless system, so the closest ambulance responds regardless of where they're based, and we're all now operating community paramedicine projects. Next slide, please. I think we've walked through the anatomy of a call before, but a response time is measured from the time that the crew is notified till they arrive on scene. So if they're stuck in the hospital and can't respond, that time increases. And then the time on task encompasses the response time plus the time waiting at the hospital. And that's broken down to how long it takes to be actually triaged by the nurse in the hospital, and then waiting to clear the bed and then clear the hospital. So that takes up, that is what is encompassed in the time on task. Next slide. So over the last 4 years, responses in Eastern Ontario have increased by almost 21%, and the service has declined in terms of UHU and time on task. With offload delays, as I mentioned, in 2018, they estimated about 4.8 12-hour ambulance shifts per day were encompassed in offload delay. And by 2022, that was up to 17.2 12-hour shifts across the region at a cost of about $17 million. In terms of staffing levels, across the region, 90% of paramedic staffing is frontline paramedics, and you can see Frontenac numbers are there. As Kelly mentioned, we're among the top 3 biggest services in the region, along with Peterborough and Hastings. There's a total of 79 ambulance facilities and about 286 vehicles across the region, and 177 of those are ambulances. Next slide. Call volumes, Frontenac staggers our start times a little bit so that we have overlap and hopefully can provide coverage while shift change is occurring. And you can see that the higher call volume in Kingston, our staffed hours are higher. Our operating costs are in line with the other big services in the region. Next slide. And when you look at a cost per call, a call volume affects that. So if you look at, compare us to something like Halliburton, because our paramedics are doing more calls in a 12-hour shift, the cost per call is less than in an area like Halliburton where they have to be spread out. They do fewer calls, but they still need to have the vehicles in those regions. So cross-border billing, cross-border, we do have cross-border agreements with all of our neighbors. And you can see in this slide that in all services, there are cross-border calls happening. We primarily do cross-border calls into Lennox and Addington, Leeds and Grenville, a little bit into Renfrew and Lanark. But there is a cost to this because we do pay our neighbors to come into our region and do the calls in our region. And they pay us. However, in the current situation, we're paying them a lot more than they're paying us back because they're doing more calls in our area. So community paramedicine is now a norm across the region. As I said, the money savings is to the healthcare system overall, not specifically to the paramedic services. But if we can decrease ER visits, then we can help with the offload delay as well. So we do need the permanent funding so that we can continue to grow our program and comfortably hire permanent staff. Right now, our program is at capacity. We have 4 full-time community paramedics. So they work 40 hours a week each, and their days are completely filled seeing our current clients. So if we want to expand our community paramedicine program, guaranteed funding is going to be necessary. So when you look at the response volume predictions that were provided in this report, it's expected to rise about 5.2% a year over the coming years, reaching more than 308,000 responses. And when we did the reports back in 2018 and 2019, they were looking at maybe a 3.5 to 4%. So that has increased predictions going forward. And that's at the what they feel is the most reliable regression prediction. It's much worse if it remains high. So if we take a quick look at some specifics to Frontenac paramedics. The seniors population continues to grow in percentage and continues to increase in percentage of the number of ambulance calls that they do. So if we have more seniors and they're doing more calls for seniors, that's certainly going to impact our call volume. And they continue to build seniors residents, particularly in the west end of Kingston. So we foresee that as a continuing trend. Our specific time on task has increased by 57.3% over those 4 years, and the average call now takes 30 minutes longer than it did in 2018. We have always had a goal of having our UHU as 0.35, and we were sitting for the entire service at 0.31 back in 2018, but we're now up at 0.46. And if you look at the services at the stations just in the city, they're sitting up in the high 0.59, 0.60. So they're very busy. Our specific offload delay consumed the equivalent of almost 2.5 12-hour shifts per day in 2022, which is a significant increase from the 0.4 that it was in 2018. And offload delays are expected to continue to rise if nothing changes.
Judy? Going back to that dedicated nursing for offload speeding up, I noticed that Peterborough has twice as much funding for it than what we have here. So if you do go after more funding, that hopefully we'd have more control as well in that, but they have twice as much. They're at 0.45, we're at 0.23.
So historically, we had not been experiencing the offload delay problems as much as they had in previous years. So the funding that they had got previously continued and expanded. We did apply for extra funding about 3 years ago and it was declined by the ministry. We're hopeful now with the change in our situation that we'll see a increase in that in this application. So a few conclusions for this. The 5 priority areas are the primary targets for the Eastern Ontario Wardens Caucus. Do you have anything you want to add? Frontenac Paramedics is experiencing similar challenges to all of the services in Eastern Ontario. We're benchmarking favorably to the other large services, but we aren't meeting our response time standard or our UHU target. So we're going to need to continue to invest in additional resources to meet the demand. And it will be important to do the ORH study refresh to do a deep dive into how we plan for the next 5 to 10 years. Bill?
Thank you. So 2 comments and a question. First of all, I fully support your point number 3. When I look at the overall metrics, you deserve congratulations for the service you're providing compared to other communities. So I want to recognize that. Thank you for that. The other is we're fortunate to, as I'm sure everybody else is, to have a very effective emergency response volunteer group. And in our case, I believe almost 90, well, probably 100% of the time, they are the first on site. I think the province is undervaluing that service. I can't imagine if that wasn't there, how your EMS technicians would respond. So I think, again, adding to the point that others have made, there's a need for the province to understand the true value of that. And then I guess my question is, community paramedicine. As you know, we have challenges on Wolf Island with emergency response. Can that be looked at, or is that being looked at as a solution for some of the issues we face on Wolf?
So our community paramedicine program operates on Wolf Island as it does in the rest of the community. So other communities. So right now we've got 12 regular patients on Wolf Island and another 5 that we see periodically. And the paramedics are there about twice a month currently to see those patients.
Thank you.
Hey, Ron,
One back slide there where you were talking about that they're going to reevaluate and come up with the statistics for 2024. I don't have a problem with that if the hospital is going to tell you this is normal now. Because until the hospitals are somewhat back to normal, those figures still won't come out right. And everything that's up there says more staff, more resources, more this, more that. I understand that. However, no different than we try to do in our municipality, we're not going to staff up because of COVID. So if you're going to just use a the 19 to 24, whatever that window is there of the new study, until you can say that the hospital is somewhat back to normal, then I still don't know how you can use those statistics. So that's where I'm struggling with using statistics that were still affected by COVID and what is normal.
So unpack a couple of things. I'll start with the chief. So we've roughly been out of COVID for, let's say, a year. We've added a resource this spring. We'll be adding another resource this fall. So those things will be taken into consideration too.
They already were
Correct.
thought of before.
Yeah. So the new study will also look at where the city of Kingston is placing their bases, because obviously having a base close to where the call volume is important as well. So the city was looking at Division and Elliott, and now they're looking at Railway and Demers. So that will change the dynamic. And we think both of those are pretty good locations, but that will also change, response time. So it will give us a better idea, having had, let's say, 2 years outside of the pandemic, as well as a year past when we've added resources, to give us some sense of what the new normal is. So I agree with you. And I think that, at some point in 2024, we'll have far more information as to what the new normal looks like, not what the normal was at the peak of the pandemic. That makes sense. Chief?
A little bit to that though, station location is important. I'm not saying it isn't, but we all know they don't stay there anyway. I mean, that's pretty relevant in rural Frontenac County. It doesn't matter where the station is. They're not there generally.
Right. And if we can get the right amount of resources in the city, then that will allow the rural resources to stay in place. And the only thing I'd add to what Kelly was saying is with the offload delay, they touched on it in the Eastern Ontario Wardens Caucus report that, if we could go back to the offload delay levels we were having in 2018, what that would look like. So that might be something that ORH could dive a little more into, like if we could get it back to what it was before and attribute most of this to COVID, then what do those numbers look like?
I think what your numbers are solidifying is there is the crisis in healthcare that we're hearing from all the doctors and nurses, and we are we're a victim to that, and it's costing us more and more for paramedics because of it. Judy.
I can say that from the Frontenac Islands perspective, and specifically Wolf Island, that we're looking forward to finding some unique solution and it was interesting to find that the CAC is centered out of Kingston, because when I was asking about that before, I was directed towards Ottawa, which seemed very unhandy. Maybe that's just in dispersing the orange ambulance or something, but basically we'd like to have a conversation with CAC and find out what we can do in that for better utilizing our volunteer fire services and that for helping to transport the patient at least to the boat and that to get it faster. And that's, we don't have deliveries on the island and that without ambulances and things like that that have already occurred. And good that we have an opportunity in that to get something unique for dealing with the delays on Wolf Island, because it's not sustainable and certainly not acceptable to the residents. So we look forward to working with you on that.
Just to point out that currently it would be a violation of the act to have a volunteer firefighter do the transport. So that is not a CAC issue. It would be something you need to speak to the Minister of Health about.
And then we'll be getting a motion that is dealing with that appropriately and that and expect to have support at this level too.
I think at this level, our advice to council would be not to support it overtly because it would be a violation of our collective agreement. But the township taking that stance and taking that to the ministry is your discretion.
Okay, at this point, it is 10 minutes to 11. Do we want to take a 5-minute break before we go on in the agenda? Oh, just one
I
moment.
did want to make one small comment to what Councillor Saunders said. I think when we met with MPP, I think it is, Jordan. I think we mentioned too that municipalities are not compensated for any emergency services through fire. For medical assist. And we made that point to them too, that should be looked at. Of course, you're not going to give money if they don't have to. But it's a huge part of all of our fire departments that we're helping paramedics, whatever, citizens that we get no compensation for. So I think we shouldn't forget about that and we should keep that on a forefront too.
Okay, Jeanette pointed out that if we just finish our Committee of Management of Fairmont Home, and then we'll give Jason time to set up for our presentation on our strategic plan. So we have no unfinished business. We have no consent reports. So we do have our Committee of Management for Fairmont Home.
Moved by Councillor Saunders, seconded by Councillor Gowdy, that Committee of the Whole Council adjourn and meet as Committee of Management of Fairmount Home with the Deputy Warden in the chair.
All those in favor? Carried.
Moved by Councillor Leonard, seconded by Councillor Fowler. Be it resolved that Council authorize the purchase of the Eco3 Tax Ozone Laundry System to assist with the provision of laundry services for Fairmount Home, and further that Council authorize the use of the strategic project reserve for the county share of $5,232 from the Energy Conservation and Demand Management envelope, and further that Council authorize staff to single source the purchase of the Eco3 Tax Ozone Laundry System with respect to the time-sensitive nature of the incentive of an offer from Enbridge Gas.
Questions or comments? Seeing none, all those in favor? Carried.
Moved by Councillor Lichty, seconded by Warden Vandewall, that the Committee of Management of Fairmount Home adjourn and revert back to Committee of the Whole Council.
All those in favor? Carried. Okay, now we'll take a 5-minute break and then we'll come back to the strategic plan. And we have with us Jason, Explorer Solution, who's going to do the brief on the draft Frontenac County Strategic Plan 2023-2026. And it was in our packages, so you can skim over some of it, I'm sure, Jason. We'll have lots of questions, though, I'm sure.
Thank you, Deputy Warden. Good morning, Warden, Deputy Warden, Madam Clerk, mayors, council members, senior staff, and others who are in the room as well today. Thank you for participating in this discussion in particular. For those of you who are following remotely, my name is Jason Kipfer. I'm the Executive Director with Explorer Solutions. We are a small research and consulting firm specializing in municipal economic development and airport planning and development. Over the past several months, we've had the opportunity to really become a part of the fabric of your community, I like to think. We've had an opportunity to meet with many people in person, in group settings, virtually, through email interaction and whatnot, to really get the pulse of what's happening here locally to help drive recommendations to move this term of council forward over the next 4 years. So we are very excited today to present our proposed recommendations for the strategic plan. And we're also going to highlight some of the key themes emanating from the now complete online public survey, which we had overwhelming, very positive participation and response. So what I'd like to do this morning is share my screen. Just going to move all these Zoom windows out of the way here. So I have 3 documents that I'd like to share this morning. I'd like to start off by kind of just highlighting some of the key takeaways that were noted within the summary of consultations. Again, this is the voice of the community. We're also going to present the strategic plan report. It's a brief 10-page document. And we also have a 2-page kind of easy read brochure for anybody who is wanting to kind of quickly review and determine what the strategic priorities, focus areas, vision, mission, and so forth is here. So I will scan fairly quickly through this because I don't want this to be the bulk of the presentation this morning. So just in summary, we ran an online survey for approximately 6 weeks, pushed it out through the Engage Frontenac website, newsletters, social media postings. Very pleased to have broken the 700 participation mark with 703 responses. We held focus groups with all 4 township councils, as well as one with all of you here today. We had 2 public open houses in April at Storrington Hall, as well as Soldiers Memorial Hall. And we had the opportunity to meet one-on-one with senior staff members throughout the townships, the county, as well as City of Kingston to gain perspective and insights on particular areas that were deemed our focus areas of this responsibility of the county. So the survey results here, again, our goal was to understand and acquire perceptions, needs, priorities regarding the future of the county. And we had a sophisticated online platform to capture all of the information. Just to summarize again, the focus areas that are the areas of responsibility for the county is Fairmont Home, Land Ambulance Services, our Frontenac paramedics, transportation, social family services, planning services, economic development, corporate services, and external partnership building. So just at a glance here, this provides a breakdown of the age distribution of our participants. You can see that close to 50% of folks who participated are in kind of the 45 to 50 plus age range. But we worked really hard to ensure that the voice of our youth and young professionals were included. And you can see that we had 67 individuals representing the 15 to 24 age category. Next, we wanted to understand distribution of participants based on location of residence. We asked respondents to indicate where they located by township, City of Kingston, or elsewhere outside, because we do know that we have a lot of seasonal residents situated in the area here. Key takeaways was that 43% of survey responses were from Frontenac Islands, 19% from South Frontenac, 12% from Central Frontenac, 13% from North. We had 8% from Kingston, 5% from Kingston and 8% outside of both of those larger jurisdictions. We also asked and wanted to know if people were year-round residents or seasonal residents. We had 109 identify as seasonal residents, and approximately 65% of respondents reside or have resided in the county for more than 10 years. Also wanted to ask who of the responding participants were employed by the county, the township, or the city of Kingston. 44 individuals identified as being employed by one of those three levels of government. We had specific questions. If you indicated that you were a youth participating in the survey, and we wanted to know if those youth or young professionals were employed or studying or both or what have you. So we did get an indication that the majority of those participating were high school students. Their future plans, we wanted to know where they saw themselves living over the next 5 years, and wanted to use this survey as an opportunity to get a glimpse into the future. 38% indicated that they would be looking to remain in the county over the next 5 years. 35% not sure. 10 were not looking to do so. Primarily reason for leaving the county is the pursue educational opportunities. Also, the lack of reliable transportation to the mainland, which tells me that a number of those youth that were responding were from the islands. Okay, so moving into the 7 pillars now, we have a couple of slides to define the information here. And in a nutshell, you'll recall that all of the key objectives within each pillar, the ones that you see on the left-hand side, we asked respondents to rank in order from top to bottom what they felt were the most priority are most pressing that the county needs to focus on. The color coding here indicates that, and we've ordered this top to bottom based on #1 rank. So 33% of the respondents who answered the question around improving the quality of care and services provided to residents at Fairmont Home, that was their #1 priority. And you can see it's broken down by 2nd place, 3rd place, and so forth. What I want to emphasize here on the next slide is that we've attributed a numerical weighting to each response. So since there was 8 responses, 1st place received a rank of 8, 8th place received a response or a weighting of 1. So we ran just a mathematical equation to help us identify at the end of the day, what are the most pressing issues or areas that the county should focus on. And so at the top here, from the voice of the community of the county, improving the quality of care and services provided to residents clearly came out at #1. The second and third were expanding capacity to accommodate more residents and enhancing staff training and development opportunities. So moving forward for this presentation, I also want to acknowledge that we had 211 additional comments tied to this particular pillar, and we've attempted to consolidate and summarize the prevailing themes that came out of here. I do not want to use today's presentation to go through those individual comments. I hope you had an opportunity to do so beforehand, or please take time to do so afterwards. But I want to acknowledge that this is a hot topic for your community, as evident by the 211 additional comments provided. As we move into Frontenac paramedics, the weighted score came out almost splitting hairs here, improving response times and coverage throughout Frontenac County and increasing the number of paramedics to meet the growing demand for services. And I think that came out clear in your CAO report with Gail a few minutes ago as well, too, with adding more resources for that. The third one, with respect to the comments, we received 262 additional comments. We took the opportunity to try and make sense of those and group those into some subcategories, which were comments related to Frontenac Islands, the delivery of services, overall operations. Moving into transportation, we only had 4 options here to rank based on this particular pillar. We're almost, again, very close with the main 3 that came out on top. The first one was enhancing collaboration with the Township of Frontenac Islands and the Province of Ontario on ferry services, supporting the member municipalities in their efforts to maintain and improve roads and bridges. And thirdly was developing strategies to improve regional transportation connectivity and accessibility. The fourth was promoting alternative transportation options such as cycling, for example. On this particular question, we wanted to learn a little bit more about the general feeling from each of the townships compared to the county with respect to the transportation piece. And as you can see, we've attempted to color code the common themes to see what was of most important, because we know that your county is long and narrow and spans a significant distance from North Frontenac to the islands. We wanted to see if all townships shared the same priorities from a transportation perspective. And if not, you know, what was the pressing issues for those individual townships, and how did they relate to the collective voice of the overall county here? We received 179 comments tied to the transportation pillar, which we broke down into a ferry, island transportation. Sorry, this was a duplication slide here, so we've already touched upon that. Moving into social services and affordable housing. Here, again, the top two are very closely aligned. First was ensuring equal and fair access to social services, childcare, and social housing for county residents, followed by advocating for additional funding and resources from provincial and federal governments for social services and affordable housing. To round it out, the top three was investing additional resources in the availability of affordable housing and related services, such as rent assistance, for example. We received 135 comments tied to the category of social services and affordable housing, which we split up into affordable housing and seniors housing, and zoning and services. Moving into the category of planning services, almost a three-way tie here. At this close, it's hard to really indicate which one dominantly is more pressing than others if we had a larger sampling from throughout the county. But working with the townships to improve and sustain the villages and hamlets across the region did edge out by 1 point here, developing regional tools and policies to support long-term protection of lakes, rivers, and other important environmental features in Frontenac, and supporting different forms of housing, such as small apartments, affordable houses, and seniors housing, for example. Within planning services, we received 118 additional comments, and we lumped them under the category of land use and development and environmental concerns. In the stream of economic development, number of options that are very important to the sustainability of the county, and also very important to the county as a whole, county residents as a whole. Coming out on top was providing business support and resources to existing and prospective businesses. This tells me business retention and expansion. Secondly, attracting new investment and business to Frontenac County. For those of you know, foreign direct investment or business investment attraction, those two are I'll say commonly grouped together in general terms. Thirdly, supporting workforce development initiatives to create job opportunities and retain talent. Came out in third place. Fourth was just fostering innovation and entrepreneurship within the community. What was of interest? I won't say of interest. What caught my eye was that towards the bottom, third last was developing and promoting Frontenac County as a tourism destination, and then promoting the Frontenac K&P Trail as a recreational and economic asset. What this tells me is that your county and your economic development department has done a fantastic job building the trail, building tourism within the community here. And now we're at the next evolution of what does that look like? We built it, we're promoting it, they're coming. We know that there's some work to be done in North Frontenac, I believe, to finish the trail, but it did catch our attention that those two were at the bottom, and we're trying to make sense of those reasons why. We received 95 comments tied to economic development, which we broke down into the categories of tourism, community and workforce development, business retention and expansion, and investment attraction. Next was corporate services. Here, the leading priority for county residents was ensuring efficient and responsible financial management of county resources, closely followed by ensuring transparency and accountability of the governance of the County of Frontenac Council and its committees. And thirdly, ensuring community engagement remains a continued priority, and to develop dynamic solutions to improve citizen awareness, involvement in County of Frontenac activities. Fourthly, I do want to make a note here because this is an important one, expanding shared services to support townships to ensure value for ratepayers. We received 58 comments with respect to corporate services. They're summarized below. And generally in partnership building, we wanted to ask the question, we asked the question of you when we were here together earlier on in this project, but we received 129 comments just with respect to partnership building opportunities for Frontenac County. So overall, now that we've taken time to educate participants on the survey about the nature of the priority, a little bit of information about the priority, they haven't left the survey by the time they got to this section of the survey. It was a lengthy survey and we're very appreciative of the time that people have taken to participate. We asked them overall, rank for us your top priorities from top to bottom. And here, paramedic services came out on top, clearly on top, followed by transportation, social and family services, economic development, Fairmont Home, planning services, external partnership building, and corporate services and administrative support. So we wanted to dive a little bit deeper, similar to what we did with the transportation piece. We wanted to understand how individual townships compared to the overall survey participation, how they compare to one another and to the county as a whole. You can clearly see that paramedic services did come out on top. And we are starting to see kind of a differing of opinions or priorities at the various township levels as we go down each individual ranking from second until eighth. So the big question now is how are we going to pay for this? So we asked respondents to inform us or provide us a willingness to accept a tax increase to support these services. So starting up on the top right of the pie chart, we have 19% acknowledging that they would be willing to accept a tax increase to support expanded services and strategic focuses. On the bottom right, 26% indicated yes to a tax increase, however, only for specific services. And we asked them to comment on those specific services. You can see on the right-hand side, 51 individuals indicated ambulance service. Also what stands out is ferry, road, transportation services. On the bottom part of the chart in gray, we have 24% of respondents indicating that they're not willing to accept a tax increase above inflation for expanded services and specific programming. The yellow on the left side represents 9% of respondents that are not willing to accept an increase and would be willing to accept a reduction in municipal services. And 22% is a fairly large representation. They're still not sure. They need more information to make an informed decision. However, if we take the 26% and the 19%, that gets us what, 46%, 45% in favor of a positive increase to support expanded services or specific services, which I think is a good sign that the community is supportive of the requirements to move this community forward over the next term of council. So again, we broke this down by township compared to the overall survey to understand the general feeling or sentiments from each township about a willingness to accept an increase to support those recommendations and those particular activities. They are displayed on your screen. The last question we asked was what additional services would you be willing to accept a tax increase to support that go beyond the scope of the county's strategic priorities? And 238 respondents indicated a willingness to support funding for physician recruitment or attracting doctors to the county. 152 indicated funding to support additional rural transportation. Thirdly was grants to hospitals, and then kind of tourism and broken down by the other ones at the bottom here. Overall comments. We did, as people finished the survey, we just asked them one last time, anything else that comes to mind that you would like us or the county to consider. We've received 92 additional comments and have attempted to summarize and put those into specific themes. You'll recall that you all participated in a council focus group discussion with myself and my colleague. We have taken that information, have summarized it, tried to indicate kind of the priorities. We did ask some slightly different questions when we engaged each of your councils over the duration of this project. And so what we've done when we present the strategic plan is to try and pair the prevailing themes coming from council, looking at the voice of the community, trying to make sense of the distribution of that voice, the weighting of that voice throughout the county as well too. So this information, there are a number of slides that summarize the key takeaways from our council discussions, and I have included those more as a reference piece for the council that's here with me today. And also just some additional information. Consider this kind of, again, this is a summary of consultations. I just wanted to let you know about some of the ways in which we've presented the information that we didn't share in the first few slides here. So those are listed there. And then lastly, the weighted score, you'll notice that at the top, we have North Frontenac. At the bottom, we have the county, and we have looked at each township compared to the county in terms of its priority ranking of those individual focus areas. And that's for you to take a look at, and please feel free to discuss those with your individual councils for the townships that are here today. So that is the first presentation. Second presentation is the 8-page document right now, which is our recommendation for guiding the community forward over the next term of council. What I would like to do is introduce you to the document, to the way it's laid out, some of the key information that's in here that we will be looking to request your approval on. Yes.
Well, I was just wondering if I could make a couple of comments on the first part there.
Yes.
I find it a little bit somewhat funny that quality and care at Fairmount Home to add more, better care, more staff, more this, but when we have the actual residents' response and their families, it was actually quite high. The level of satisfaction of care at Fairmount. So it's outside people that are saying they don't think it's or needs to be increased, but the inside level of service was quite high when they did the response. So that's a little bit of an anomaly there. I always agree with attracting businesses, but I'm sure all the municipalities are no different than us. We have never, ever set business land aside. So it's just not that simple. And I know that CFDC or whatever they're called now always make the same comment. Well, if you had available lands, you would attract business. But as municipalities, we've never done it. And just not sure how you would start now either, but it's just not there. So businesses attraction is somebody's going to buy a piece of land somewhere and go through the whole process. I guess on the corporate services side, I'm glad at least it didn't say elect smarter counselors. And the other part, social services. I know there's a lot of comments in there about social services. I guess we touch on it a bit, but that's not really our role either, per se. We do a little, some of it. I'm not saying with paramedic, those kind of social services are paramount, but the social service aspect is run by the city of Kingston. They manage it from the province of Ontario. So we don't have a huge impact or direct on social services, in my opinion. But those are just a couple of comments that I see coming out of it that I thought were a little bit of an anomaly to me.
To add to that, we do sit on the housing committee, but it's very much City of Kingston focused. I sat on it for years and Nikki's on it now. Judy?
You may mention about the comments, some of them 219 comments, and then it's summarized into maybe 10 comments. Would it be possible to get that raw data so that we could have a better view of what the comments actually were?
Yep.
Thank you very much.
Yep.
Okay, let's go on.
Thank you. So the way this document is laid out here is we take some time just to introduce the strategic plan, the community as a whole, some high level statistics about the community, its geography, and its perhaps shared boundaries with City of Kingston. We move very quickly into the guiding vision for Frontenac County and the mission statement. This is a vision and mission statement I shared previously. I'll share it again here, but is to be a thriving and sustainable county that balances economic growth, environmental preservation, and individual lifestyles, ensuring a vibrant and inclusive community for current and future generations of Frontenac. Our mission is committed to proactively promote and support managed growth in Frontenac County, leveraging its economic potential while preserving the county's distinct natural environment and respecting the diverse lifestyle choices of our residents.
Vicky.
Thank you. Could you just describe the difference between individual lifestyles and diverse lifestyles and what you mean by both those terms? Please and thank you.
Individual lifestyles. I live in the city. That's a lifestyle that I want for myself and my family. We have settlement areas throughout the county. We have a great island lifestyle opportunities. We have a lifestyle that's close to the city of Kingston. So I think lifestyle choices are, if an individual or a family, this is how we interpret it, makes a decision to locate themselves in a geography that has or has not certain amenities, that's a lifestyle that they're looking to create for themselves and their families. Diverse lifestyles, we want to take in consideration age, sex, race. We want to we want to promote Frontenac County as a diverse, multicultural, accepting, inclusive community. And we want to make sure that subtly we acknowledge that, and we know that people will interpret specific words differently. But we wanted to do it softly and respectfully in a way that says that we're open for business and we embrace everybody that's here. Thank you. So strategic priority number one is to develop a regional approach to overcome infrastructure issues and maximize infrastructure development opportunities. Within this, and a lot of this is guided by the top three priorities that came out as the collective voice of the county. So here we're looking for the county to support member municipalities in their efforts to maintain and improve roads and bridges. We're looking to develop strategies to improve regional transportation connectivity and accessibility. And thirdly is to enhance collaboration with the Township of Frontenac Islands and the province of Ontario on ferry services. What I would like to do is explain these on a separate page a little bit further down with some additional context. So the direction for development of the operational plan for strategic priority number one. In supporting ferry service to the islands, it is understood that the ferry asset is owned by the Ministry of Transportation, is governed by Transport Canada, and its daily operations and collection of fees are handled by Frontenac County. The county can continue supporting the Township of Frontenac Islands to ensure that they have a platform by which their priorities and funding requests are openly conveyed to the appropriate provincial and federal government agencies. To ensure that countywide roads and bridges maintain their current level of service, the county should explore opportunities for partnership with the townships to unlock provincial and federal infrastructure funding. Lastly, the county will ensure that residents are empowered to share their thoughts, opinions, and ideas to better regional transportation connectivity and accessibility. The county will also strengthen coordination and communication between transportation service providers and local governments.
Judy?
A quick question that your strategic priorities, they don't seem to line up with what you presented as the overall strategic priorities weighted at the back and that in the original. So in other words, land ambulance services was number one, transportation number two, social and family services, et cetera. But you're starting right off with infrastructure, which was much lower down the list.
We are, in terms of, we have tried to group some of the priorities that were of the 7 pillars into more broad stroke statements. The strategic plan is a guiding, and we looked, very closely at how the previous 2019 to 2022 strategic plan was put together, and it was very broad stroke statements with some specific actions. In some of our priorities or broad stroke statements, we do indicate that, for example, Frontenac paramedics, social services, and Fairmont Homes are categories under a particular strategic pillar. We are not ranking the priorities from the voice of the county in this document based on the overall feedback. They're all important. They all need to be done. If there's an interest by the county council to reorganize the order, that's, I'm okay with that. However, when we presented kind of the thought process to the project steering committee, the idea was, and I can pull the visual out for you afterwards, Mayor, we have two foundational pieces that are tied to infrastructure, to building the foundation for the community and progressing economic growth within the community as well. Above this is kind of focusing on quality of life. And then we have a pillar that is administrative corporate services that supports all of these activities. So the way we chose to present the information in this strategic plan was present the stuff that needs to lay the foundation in order to get to the quality of life. And then we have the county supporting all of it. That was just our rationale for organizing the information. But because this is a draft presentation, we're very happy to make some amendments.
I just need to break in for a housekeeping issue. It is 11:30. We're only at the first part of our agenda. How many people would stay for lunch? If we order pizza now, it will take about an hour. Or how many people would stay to eat, or would you prefer just to carry on and find food on the way? How many will want to stay to eat? Nobody. All right, go on.
Thank you. Second strategic priority is to contribute to the progress of sustainable economic growth and prosperity throughout the county, with objectives to work with townships to improve and sustain the villages and hamlets across the region, to develop regional tools and policies to support long-term protection of lakes. Is this okay? The flashing? Develop regional tools and policies to support long-term protection of lakes, rivers, and other important environmental features in Frontenac. Support different forms of housing, such as small apartments, affordable houses, and senior housing. Provide business support and resources to existing and prospective businesses. Attract new investments and businesses to Frontenac County. Support workforce development initiatives to create job opportunities and retain talent. The direction for development of this operational plan is to ensure that the community is consulted and that townships are included in all phases of planning. Secondly, is to develop policies that mitigate development impacts on the county's many environmental assets and features. Thirdly, is to develop policies that increase the number and variety of housing stock to meet the needs of residents through their various stages of life. Fourth is to encourage the collaboration of new technologies tied to communal services that can encourage residential development in strategic areas throughout the county. And lastly, to identify efficiencies in partnership with townships to more effectively deliver and streamline the delivery of economic development services and supports necessary to retain, expand, and attract businesses or business investment to the county.
Need to swap out your microphone, Jason.
On that note, if you look at those 5 bullets, if you move the 4th bullet up to the 1st, it takes care of a lot of those other things. Not all of it, I understand that, but especially around villages or hamlets or intensification or any of those things about mitigating impacts on.
Thank you.
Is that agreeable to folks? Okay, let's suggest that.
Thirdly, is to strengthen the quality of life through enhanced service delivery. And here is where we had broken these up into 3 specific areas. Firstly, tied to Fairmont Home, improve quality of care and services provided to residents, expand the capacity to accommodate more residents, and enhance staff training and development opportunities. Tied to Frontenac paramedics, improve response times and coverage throughout Frontenac County, increase the number of paramedics to meet the growing demand for services, and provide additional facilities for Frontenac paramedics that will effectively meet a steadily growing demand for services and accommodate more paramedic training. And thirdly, a focus on social services and housing, ensure equal and fair access to social services, childcare, social housing for county residents, advocate for additional funding and resources from provincial and federal governments for social services and affordable housing, and invest additional resources in the availability of affordable housing and related services. We put these together because another thing, and for those that are following remotely, these are initiatives that Frontenac County and the city of Kingston collaborate on jointly, strategically, and financially. And we felt that having those together, we're wanting to also, as an added benefit of the strategic plan, take a relationship with the city of Kingston from good to great and help guide the conversations between your two jurisdictions and the provincial government as well too. The direction for development of this operational plan is to ensure that the community and the townships are consulted to better understand, define, and quantify the demand for countywide paramedic services, retirement housing, and social services and social housing. Secondly, is to establish open, transparent, and frequent communication with the city of Kingston to ensure the efficient and effective delivery of Frontenac paramedics, Fairmont Home, and social services and housing to county residents in a manner that ensures their long-term viability and sustainability. And thirdly, is to support the integration of proven technologies capable of minimizing paramedic response times to medical emergencies. And I believe I heard a bit about that this morning in this presentation.
Okay,
Thank you.
all right,
Oh, I'm sorry. I have two more bullet points for that particular one.
okay.
Fourthly, is to encourage the development of affordable and social housing in areas that are best served with supporting infrastructure and amenities in proximity, such as public transit, grocery stores, elementary schools, childcare, health clinics, and social services. And lastly, is to identify best return on investment scenario to guide decision-making on increasing capacity at Fairmont Home.
Okay, so we'll open it up for discussion. Does anyone have any issue that they don't like or that they need explained? Judy?
I think that the aspect of the ambulance should be moved up to the number one priority area, and that I know there's discretion there, but that was very clearly from across the board of all the counties, the number one issue. And second to that, transportation related stuff. I think it should more closely align what your actual study reflected, not necessarily what might be a different emphasis on the
Sure.
county.
Okay, thank you for that comment.
Do people agree with that? Yeah. I don't see anybody jumping up and down, so, okay.
Thank you.
Anything else? Excellent. You have made strategic planning likable again for me.
Before you finish your sentence, I appreciate where you're going with this. I do have one more strategic priority to share with the group.
Maybe I'm going to change my mind.
Well, we're here maximizing administrative leadership within county administration. So the objectives here are to ensure efficient and responsible financial management of county resources, to ensure transparency and accountability of the governance of the county and Frontenac, including council and its committees, ensure community engagement remains a continued priority, and to develop dynamic solutions to improve citizen awareness, involvement in the county of Frontenac activities, and to promote collaboration with member municipalities. The directions for development of this operational plan is to justify the short and long-term financial implications tied to investments in major economic and/or infrastructure-related projects, incorporate best practices to enhance community outreach and awareness while providing accessible platforms that empower and allow residents to voice their thoughts, opinions, and ideas. And lastly, to maintain open, transparent, and frequent communication with the city of Kingston to assure the efficient and effective delivery of Frontenac paramedics, Fairmont Home, and social services and housing for county residents.
Okay. I especially like these last two pages.
Thank
As
you.
a brochure that we can have in front of us and quick recall of the points. Ron?
I just wanted to go back to the comment that you made about lifestyle choices. And I think that's important. And I'm not saying that I think the county, myself personally, I'm sure other people here would disagree, obviously, have supported the ferry system, the islands, all of those things, and never supported. But that's a lifestyle choice. And I think it was very important when you said, I made a lifestyle choice to do this, so I also should recognize what that service is. And I think that's important too, though. No different than if you move to Floyne or wherever you are, you also have to take into your own account, in your own mind, to say, I made that choice. So am I going to get a ferry service, or am I going to get a paramedic in 15 minutes? Probably not. But there are lifestyle choices, no matter, like you said, if you live in a subdivision or you want to live in the middle of the bush. That's important too, that people have to realize those are lifestyle choices too.
And that's Frontenac County.
They chose how to get on. They weren't sure how to get off.
Okay, Judy?
Just for information's sake, and that the townships that was originally Howe Island as well as Wolf, and that are probably two of the oldest townships in all of Ontario. Our town hall was built in 1859. It wasn't a lifestyle choice, it is life. We live on the island, we work on the island, we are a major agricultural production. We are a place that has 2 schools, 3 churches, a life. So whether we're on the mainland or on the island, it's where we live. It's where we've lived for generation after generation after generation and contributed from there. Thank you.
Okay. Go ahead, Fred.
Oh, sorry. They, like talking about lifestyles, we moved in our area because not only we liked it, but it was also what we could afford. Like if I wanted to live where I really wanted to move to, I wouldn't have been in North Frontenac. I might have been in another area. So a lot of that is what you can afford as well. It's not a, it's not 100% a choice, but sometimes it's taking the opportunity that's handed to you.
Agreed.
Moved by Councillor Greenwood Spears, seconded by Councillor Saunders. Be it resolved that the Council of the County of Frontenac receive for information the Office of the Chief Administrative Officer draft Frontenac County Strategic Plan 2023-2026 report, and further that the Council of the County of Frontenac approve the draft Frontenac County Strategic Plan 2023-2026 attached to this report as Appendix A, and I'm just going to put as amended to move paramedic services up to priority 1.
Madam Chair, with permission of council, if you wouldn't mind, I would like to ask if D and E could be dealt with now.
Okay,
If council is agreeable to change the procedure of it, I'm leaving at, I said 11:40. And council knew that, or staff knew that ahead of time before this meeting was called. I really have to go, and I know Ray is leaving. So those are 2 things that
okay.
have
All
to be
right.
dealt with, if that's okay with council's.
No one has a problem with that? Okay, let's move to D then. The Ontario Land Tribunal for Expropriation of Lands.
So through you, Deputy Warden, there was just a slight wordsmithing to this recommendation. So it's moved by Councillor Fowler, seconded by Warden Vandewaal. Whereas both the Ontario Land Tribunal and county staff have recommended that expropriation of these lands is necessary for the purpose of linking 2 sections of the Frontenac KMP Trail for the reason of ensuring its continued long-term viability as a public trail within the County of Frontenac Trail System. Be it resolved that the Council of the County of Frontenac receive the Office of the Chief Administrative Officer consideration of the 2 decisions by the Ontario Land Tribunal for expropriation of lands for the purpose of the KMP Trail report, and further that County Council affirm its decision to certify its approval of the expropriation of the lands legally described as part of lots 2 and 3, concession 8, geographic township of Palmerston, now the township of North Frontenac, County of Frontenac, being part of PIN 36209-0002 LT and PIN 36209-0011 LT. More particularly, Part 2 on the draft expropriation plan labeled project number 2021-0733-5 and Part 1 on the draft expropriation plan labeled project number 2021-0733-4 as set out in County Council's decision on motion number 42-22 at its meeting on March 16th, 2022. And further, that County Council affirm its decision to certify its approval of the expropriation of the lands legally described as part of Lot 3, Concession 8, Geographic Township of Palmerston, now the Township of North Frontenac, County of Frontenac, being part of PIN 36209-0010 LT, as set out in County Council's decision on motion number 42-22 at its meeting on March 16th, 2022. And further, that the warden and chief administrative officer be authorized to execute the certificate of approval, Form 5, under the Expropriation Act, RSO 1990, Regulation 363.
Any discussion on this motion? Fred?
So I'm looking at these PIN numbers and trying to visualize where these properties are. I went to the Frontenac maps and I looked up those areas that would encompass the KMP trail. And I found an entirely different PIN number. I'm just sort of confused by where do these PIN numbers come? They don't match these PIN numbers.
These are the PIN numbers that were used in the expropriation documents. Yeah, so the courts actually set out these PIN numbers in their orders. So we have to trust that they're accurate. Yes, Jerry?
Just by way of that, I was on the committee of adjustment for a township in North Frontenac, and sometimes we ran into that. And Frontenac maps, good as it is, sometimes does contain errors with PIN numbers and so on.
So just to verify, the planned expropriation stuff. So they exist when the plan is deposited.
Okay. Okay. All right. All those in favor? Opposed? Carried. Okay, and we're going to move to the land conveyance and transaction with North Frontenac. Sorry, E, and then
Moved by Councillor Lichty, seconded by Councillor Greenwood Spears, resolved that Council of the County of Frontenac receive the office of the Chief Administrative Officer expropriation of lands for the purpose of the KMP Trail report, and further that the clerk be directed to introduce bylaws later in the meeting to authorize an application to approve the expropriation of lands for the purpose of the KMP Trail.
okay, discussion. All those in favor? Opposed? Carried. There, Mr. Warden. All right, we're going to go back now to C, which is the Elbow Lake Bridge replacement update.
Moved by Councillor Gowdy, seconded by Councillor Leonard. Be it resolved that the council authorize the warden and clerk to enter into a contribution agreement with Trans Canada Trail for $60,000 to be used for the replacement of the Elbow Creek Bridge. And further, that council authorize the warden and clerk to execute any agreements associated with the grant from the Ontario Federation of Snowmobile Clubs should the county be successful in its application.
Any discussion? Jerry?
I read this item with interest, noticing that the bridge was only 6 or 7 years old and it had failed or was in the process of failing. I'm certain you did go back, but it's nothing like, did you talk to the original contractor, the designers and so on?
Richard can answer that.
There's nothing in the report saying that.
I believe the original contractor is no longer in business.
The deputy warden is correct. We actually had two bridges constructed by this contractor, one at Fish Creek and one at Elbow Creek. Both bridges failed. We managed to get a replacement deck at Fish Creek from this contractor. But when we pursued them for this bridge, we were no longer able to contact the original contractor, so we had to go fulfill a full replacement approach.
So this is obviously manufactured somewhere and the contractor just purchased it and installed it. Can you go back, or could you look at going back to the original manufacturer, like where it was created originally?
So these were a design, build, install contractor. So they built the bridge using their unique proprietary system, which is was untested, let's say, at the time, but came in lowest on our bid sheet. And so after reviewing, and this was prior to my time at the county, the choice was to go with the low cost solution.
Thank you.
$60,000 to replace that's a pretty good price for a bridge.
We were very pleased with the $67,000 bridge. That's not the installation. That's just the creation of the bridge and delivery to the site. We're going to tender for the installation, which we expect to be another $120,000 to remove the existing bridge, prepare the lands, and install. So we'll be up in closer to $200,000 when all is said and done.
Yeah,
That makes more sense.
okay, Judy?
How long has Algonquin Bridge been in business, given Bitten before?
Good question. And so, yes, Algonquin Bridge has a very good reputation. They do these kinds of bridges all of the time through Eastern Ontario. They are not new. They're based in New Brunswick, I believe, and they've got a very successful business. So we're able to track their record better than the previous contractor.
And get some kind of a warranty.
Correct. Yes. Warranty is
Okay.
only good if the company's still working now.
All right, all those in favor? Oh, sorry, Fred, another question?
Yes, just one more clarification. So there's going to be more money spent on this bridge. Where is that money coming from?
So in the report, if we go down to the financial implications, it speaks to the fact that County Council last July authorized use of the capital reserve for the full replacement of the bridge, up to $300,000 actually. Since then, I've been able to secure this $60,000 grant opportunity with TransCanada Trail, and we're in the process of getting approximately another $67,000 from the Ontario Federation of Snowmobile Clubs. And as we move forward with them in their process, we may be able to secure more funding. So more than 50% of our anticipated costs at this stage is looking to be funded either by grants or partners, essentially.
Yeah, that's pretty good. Thank you.
Okay. All right, all those in favor? Carried. Now, we're going back to F, yes.
Moved by,
Motion. Go ahead.
moved by Councillor Saunders, seconded by Councillor Gaudy. Be it resolved that the warden and clerk be authorized to enter into an agreement of purchase and sale with the Township of North Frontenac for lands in pin 36209-0012, pin 36209-0030, and pin 36209-0231 for $1. And further, that the county clerk is hereby further authorized to execute all closing documents as may be required in order to complete the subject transaction, and to do all other things as may be reasonably be required to close and complete the foregoing transaction. And further, that staff work with the Township of North Frontenac to establish an agreement with use of identified road allowances, outlining the responsibilities of each party for the trail and road management when the two uses intersect.
Okay, any questions or comments? Seeing none, all those in, oh, Fred? That's okay.
I'm not quick enough.
There's only one of you over there. I look second.
Yeah, I'm all by myself here. These lands are already owned by North Frontenac, and we've seen the deed that says that this North Frontenac land?
We've done some research at the land registry office to determine ownership, and these are owned by the township.
Okay. All right, all those in favor? Carried. Information reports, there's a couple, three there. Any questions on those? Seeing none. There's no report from the advisory committee of county council. We will now have a motion to return to council with the deputy warden still in the chair.
Moved by Counselor Leonard, seconded by Counselor Fowler, that council revert from committee whole council to council with the deputy warden in the chair.
All those in favor? Carried. Okay, adoption of the report of the committee of the whole.
Moved by Counselor Saunders, seconded by Counselor Lichty, that the report of the committee of the whole council be adopted and that the necessary actions or bylaws be enacted.
All those in favor? Carried. There's no giving, no notices of motion, no giving of notice of motion unless someone has something. Seeing none. Communications. Pages of it. Other business. Bylaws. Any other business to come before council? Seeing none, we're at the bylaw section.
Moved by Counselor Greenwood Spears, seconded by Deputy Warden Smith, resolved that leave be given to the mover to introduce bylaws A through J that have been circulated to all members of County Council, and that bylaws A through J be read a first and second time.
Any discussion? All those in favor? Carried.
Moved by Counselor Greenwood Spears, seconded by Deputy Warden Smith, resolved that bylaws A through J be read a third time, signed, sealed, and finally passed.
Discussion? All those in favor? Carried. Okay, that is it. We are going to adjourn this meeting at
Move-
11:57.
Moved by Counselor Saunders, seconded by Counselor Gowdy, that the meeting hereby adjourn at 11:57 a.m.
All those in favor? Carried.